With so many people feeling the pinch, the price of health care continues to climb and families are really feeling it.
Everything from high insurance premiums and deductibles to surprise bills for things like basic care. More people also delaying doctor's visits or simply cutting back on their medication because of the price. The rising cost of health care is today's big story. Well, the latest government numbers show millions of Americans have dropped health insurance plans under the Affordable Care Act. And as ABC's Elizabeth Scholze reports, analysts and the Trump administration have differing views on what's causing that decline.
This is the first time we're seeing how millions of families are losing their health insurance as costs go up. A new government report shows about 19 million people were enrolled in the Affordable Care Act in the first 2 months of this year. That's down by 3 million compared to last year. The Trump administration says this is because of its efforts to crack down on fraud, but healthcare analysts attribute this decline to soaring insurance costs after federal subsidies expired at the start of this year. So the nonprofit KFF says that the average premium is up 58% this year, from $113 a month to almost $180. They do expect that millions more people will be forced to drop their coverage this year amid these higher costs. And remember that those expiring subsidies were at the center of a fight on Capitol Hill last year that resulted in the longest government shutdown in history. Elizabeth Scholze, ABC News, Washington.
Everyone is really struggling with those costs. It's, you know, there's not a one of us that's like, oh, this is totally fine.
The higher insurance costs making it harder for things like small business owners to balance their books. Michigan, for example, a new survey found nearly 80% of owners reported double-digit increases in employee health care premiums. Riley Connell looks at how the business community is working to overcome that expensive hurdle.
Healthcare is really scary for us, to be honest, because it just basically doubled overnight for us.
Lansing business owner Summer Schreiner is not alone. The Small Business Association of Michigan reports some members are seeing healthcare premiums increase by as much as $2,000 per employee.
You know, there are 5 of us, so we're a pretty small operation here.
But Schreiner says costly insurance could force her to pause new hiring efforts at both of her Lansing retail stores, Grace Boutique and Bad Annie's. The financial struggle goes beyond health care. Harrison Leffel-Jones with the Lansing Economic Area Partnership says tariffs and inflation are driving up the cost of doing business.
So the finished products continue to go up in price. And then also for our manufacturers and our smaller scale folks who are actually creating goods, those raw materials continue to get more expensive.
Leffel-Jones says business owners are finding creative ways to get customers in the door, like expanding online sales options. Schreiner is hoping to hold on to her patrons and employees by selling an experience, not just a product.
Stores are not going away. Convenience online is great, but it can also be really inconvenient when you have to keep ordering things because they don't fit you or they don't quite flatter you. When you have people in your community that are ready to help you, you know, anytime and excited to help you find just the right thing.
Now, with all that said, there is a legislative effort underway that would allow small businesses to create what's called an association health plan, meaning they could pay for employee health benefits together, hopefully lowering that overall cost.
And in Ohio, there's an effort aimed at lowering healthcare costs for employers and expanding the choices for employees. The legislation, which passed the House last June, would allow a tax credit for small businesses that offer individual coverage health reimbursement arrangements, and those would be offered to employees. They're employer-funded, tax-free benefits. So instead of having a company-wide group plan, employers give workers a monthly allowance, and then workers buy their own individual health insurance to meet their specific needs, and then they get reimbursed. The bill is currently in a Senate committee.
And when those medical bills come in, have you ever questioned the costs? Well, you are not alone. Here in Ohio, a new law is coming along. All hospitals have to be transparent with their pricing, and the state health department has to enforce that law. Jonathan Walsh from the ABC affiliate in Cleveland now with what that enforcement looks like.
Did they ever tell you how much all this was going to cost?
No.
Tim Hardy from North Canton says he called ahead of time and talked to staff of Summa Health's Green Emergency Department about needing help with some stitches.
It was given nothing but the affirmative that, yeah, this was going to happen. We'll take care of it. We do it all the time, no problems.
But he says the doctor then told him he could not do anything for Tim. He then received a bill from Summa for $1,600 and another bill from the doctor's group.
The actual doctor, that was over $700.
So $2,300 bucks.
$2,300 for basically taking up space and having maybe 3 or 4 minutes of the doctor's time.
To say the least, Tim has been frustrated.
Any other good or service I buy, no matter how simple or complex, I have a very good understanding up front.
The Ohio Department of Health, or ODH, is responsible for enforcing the hospital price transparency law in 200-plus hospitals in the state, making sure, for example, health systems show prices for services in dollars and cents.
We can stabilize the cost of healthcare and hopefully someday drive it down because the transparency and the price is out there.
Ohio Representatives Tim Barhorst and Ron Ferguson are the architects of the law that went into effect last year. ODH's first enforcement list showed half a dozen medical facilities not in compliance. This month shows just one hospital in the state not complying. Is Representative Ferguson a bit skeptical about that?
People at the Ohio Department of Health probably aren't going to be as strict as consumers, actual Ohioans, would be.
News 5 investigators were persistent with questions to ODH, which then admitted it does not audit every hospital each month. It just puts out a list as required. But since 2021, the feds have been leading the crackdowns on hospitals, including most recently involving hundreds of facilities.
This is the largest enforcement action we've seen to date by far.
Ilaria Santangelo is the director of research for PatientRightsAdvocate.org that's been tracking high rates of noncompliance from hospitals across the country for years now.
96% of Americans want price transparency. So the more monitoring, the more enforcement from Ohio or from the federal government, this is great for all American patients.
But there is a big difference at the heart of that enforcement. News 5 investigators combed through pages and pages of federal data and found CMS cited 19 different Ohio hospitals since January, while the most that ODH cited this year was 5, with each monthly list having the same hospitals, except one facility would basically come off the list every month, all showing the feds keeping its pulse on price transparency more. The American Hospital Association said this month improving price transparency is not working, calling the requirements on hospitals a significant administrative burden, and the complexity of health plans is much of the challenge to giving patients true prices. Meanwhile,
but in this case, it's just really sticking in my craw.
Tim tells us he got the doctor's $700 bill dropped. Summa apologized to Tim, cut its $1,600 bill in half, and said in part Tim was billed accordingly. Tim tells us more transparent details should be given to patients on their way out of appointments and procedures.
All the materials that were used, all the processes, tests, so you had an idea what you could expect coming in the mail.
Higher premiums, they can also take a toll on medical debt, which is a leading cause of bankruptcy. And there have been a few efforts in our communities here in Ohio and locally to wipe out those payments. 2022, for example, the city of Toledo and Lucas County entered in a partnership with RIP Medical Debt to help people. It's now called Undo Medical Debt. It's a nonprofit that buys medical debt at a discount from healthcare providers to help ease the financial burden for individual patients. The city says so far more than $230 million in medical debt has been abolished for more than 112,000 people in the region. Lowering those premiums is also part of a package that was introduced in early spring by Ohio Democrats in the State House. It's called An Ohio You Can Afford. If it was passed, it would establish the Ohio State Reinsurance Program. And once enrollees' annual medical costs top $30,000, the program would reimburse insurers for 80% of the claims.
Meanwhile, at the national level, congressional Republicans say they have a health care plan that can make Americans' lives more affordable. And now is the time to act. 13 Action News Washington correspondent Brendan Cullerton has their pitch from Capitol Hill.
Republicans say too many government resources are being spent on insurance companies and middlemen in the healthcare system. They believe it's time to change that system so more money goes directly to patients. Republicans gathered on Capitol Hill to say there is a root cause to the lack of affordability in America.
You want to know why families are hurting? Healthcare costs. Let's fix it right now. We have the willpower to do it. We can do it.
Missouri Republican Eric Burleson says money is being wasted on a system that does not prioritize patients.
Washington has gotten very good at protecting the people who profit from this maze. The lobbyists, the middlemen, the bureaucrats, They all have a seat at the table, but families paying the bills do not have a seat at the table.
Republicans are making a push to shift tax breaks from insurance companies over to individual health savings accounts, which they say will take bloat out of the system and empower individuals.
What happens if you expand health savings accounts, if you have HSAs so that they're not tied to a high deductible employer plan, that you can actually have tax effective money there to make your own decisions, and you know that those are finite dollars.
Republicans are also pushing for more price transparency and for drug companies to charge Americans the same prices they charge elsewhere. They also want to require insurance companies to be upfront about the results they can deliver to patients.
A real market lets people see prices, compare options, and take their business elsewhere. That is not how healthcare works today, unfortunately.
Democrats have consistently criticized Republicans for cutting more than $1 trillion in healthcare spending over the next 10 years. In Washington, I'm Brendan Cullerton.